Hello everyone, my name is Sharzad Green and I'm a pharmacist. My specialty has been bioidentical or natural hormone replacement therapy for the past 18 plus years. In today's discussion, I will be talking to you about vaginal dryness, especially related to perimenopause and menopausal years. During your life as a woman, every month that you have your cycle, your hormones fluctuate. They go up and down, and that usually helps you with your vaginal lubrication. As you get closer to menopause, the hormone levels start dropping. The main hormone that's really important for vaginal dryness or lubrication is estrogen. As your estrogen level starts dropping, a woman may notice more and more dryness in that area. So imagine the skin on the back of your hand. If you don't take good care of it and you go out in the cold, dry weather, it gets thin and dry and it gets flaky, and sometimes it even cracks and it starts bleeding. So that's a sign when a woman starts bleeding just a little bit, a tinge of blood from the vaginal area, especially after intercourse. That is a sign that she does suffer from vaginal dryness in a severe way. So how do we treat vaginal dryness? Before we start talking about treating vaginal dryness, let's make sure that we understand why it's so important to treat it. Well, vaginal dryness, first of all, can be very uncomfortable. Some women actually feel how dry they are as they're walking down the hall or sitting down or just performing everyday activities. And of course, it could affect your sexual well-being because if you are so dry, things don't feel right. In addition to it hurting, it could cause more burning sensation. It could cause a decrease in your libido or your sex drive and ability to reach climax. So for all those reasons, it's very important to actually treat vaginal dryness. There are many different ways to approach this subject. A lot of times you could use a lubricant, one of the things that's available in the market over the counter. And what they do is essentially they put something slippery in that area, which helps temporarily, and then soon thereafter it dries out and the woman still has to deal with the same problem. Then there are some oils, such as coconut oil or avocado oil. Vitamin E oil is the other thing. And they do help to an extent. But with that even, again, the relief is very temporary. It does heal some of that burning sensation in the tissue, but it doesn't last long enough. That's when we resort to hormonal approaches. So one of the most important hormones, as I said, for vaginal dryness, for treating it, is estrogen. And we're able to compound vaginal estrogen in a natural form, the bioidentical form, for women to use. And the way you usually use it is you use it every day for 14 days. And then after 14 days of using the cream vaginally, then you could cut back to maybe twice or 3 times a week. And that keeps things at bay. Now, I have to emphasize that estrogen vaginal cream is not a lubricant and it's not a moisturizer. What it does, it actually brings back a woman's lubrication back to normal. And therefore, it alleviates the dryness. And as long as you keep using it, the dryness stays away. Now, I am very conservative with hormones. So if a woman comes to me and she still has her uterus intact, I usually treat her vaginal dryness by giving her a very mild estrogen vaginal cream, but I make sure that she also receives progesterone. Now that progesterone could come in a pill form where she would swallow it and it goes through her whole body systemically. It could be a cream that she would put on her wrist or in her thighs, and again that gets absorbed and goes through her system. Otherwise, if we don't want to do that, and if the patient does not really need or want to do systemic hormone therapy, I put in some progesterone along with estrogen in that vaginal cream. And the reason for that is to prevent her from getting uterine cancer. I know that there are some studies suggesting that that is not a problem, that a woman with a uterus could still receive vaginal cream that's estrogen alone, but again, my thought is it's better to be safe in that respect. If you have any questions or comments, feel free to leave a note for me. I'd be happy to answer your questions and get a feedback from you. And until next time, have a wonderful and healthy day.